Hello, my name is Joe Strother with Federal Employee Service Association, FESA. I'm the Director of Sales, and today we're going to walk through what I like to call the river. It's a big section that covers Medicare, Social Security, and FERS annuity. There's a lot of things that are subject to change, and so we really just want to hit on the highlights of this section. Each client's going to be different. Healthcare might be a big buzzword, so you might talk a little bit more about Medicare. The same will apply with FERS annuity and Social Security. But for training purposes, I'm going to teach you and walk you through just the basic flow of how do we move through this river. In the middle of this river, there is military buyback and civil service employees. I will have separate videos that cover those two topics because the majority of the people you'll meet with, it really doesn't apply. Civil service, if you'll remember, those employees don't get TSP matching, and so normally they wouldn't be a qualified appointment, so we wouldn't run them. Military buyback, and we'll go into this into the video, it kind of depends on the region that you're in. If you're near a massive base, then you might be working with more military veterans than maybe someone else that's not near a base of sorts. So let's talk about Medicare, Social Security, and FERS annuity. What is the point? Hey, we're trying to continue down the same path that we've already established in the Power Start. We're informing the employee of their different options with Medicare. We're going to look and try to guesstimate what their Social Security check will be at retirement. And then if the military is applicable, then we'll cover that at this section, but not in this video. And then we're actually going to calculate and estimate their FERS annuity. The goal is to continue to keep their buying guards down while having them being very engaged. When you practice this presentation, you really, I think I say this in all my videos, need to know this presentation coming and going. Because you don't want to be so worried about what's the next thing I'm going to say about Medicare. You need to be looking right at them and see how they're responding to each topic. So the first thing, I'm going to walk through the Medicare, and then I'm going to walk through all of these sections, and then I will run through it at the end on how it would sound if I was in the house. With Medicare, there's a lot of interesting things that changed from 2008 to present day. And now with the new president, this could all also change again. So what we want to do, and I don't know if you have healthcare background or not, we want to keep the Medicare section very elementary and very clear of what their choices are. We have an advisory board here at FESA, and one of our members of that board is a health insurance expert. And he can't call them, and he will not sell them any health insurance. However, we have a picture, we have a little bio of him that you are going to leave, and it has his number, and they need to call him with any questions and concerns with health insurance. You do not want to sit here and become the health insurance expert. Even if you have a lot of knowledge, stay away from becoming a healthcare representative. What we're here to do is walk them through their benefits and how they're set up now, and at retirement, look at how their benefits are going to change. So with Medicare, if you look at their pay stub, they're paying into it. They also are going to have an HP code. They're going to have current health insurance. Most of it's Blue Cross Blue Shield. The government actually takes up a little bit of their health care costs. There's a subsidy there. And so let's say on their pay stub it's HP 105 and they're paying $125 a pay period, just to say a number. When they retire, that number is going to be a little bit larger. In their retirement package, it will tell them what their health care cost will increase to. So the first thing that you want to let them know about with their Medicare is simply that. At retirement, when they're eligible for Medicare, they can go to Medicare. They've been paying into it. You know, option A is free, but they have a full health plan. They need to look at Part B, C, and D. Those options are all the same at any insurance company. And so what you got to do is just shop and find the best price. The third option they have is compare health plans. Maybe they just need to go to the private market and find a health plan that works for them. That's it. Keep your current plan, switch to Medicare, or go buy another plan. If you're dealing with someone that's far from retirement, it does not matter for them typically. They're usually like, oh, whatever, I'm just going to keep what I have. If they're close to retirement, this could be a big deal, and you really want to push onto them communicating with Harlan, because he will guide them to a right representative or guide them to the right decision. So if you're looking at your PBA, which you should have in front of you, you're looking at page 3, Medicare. You turn the page to page 4. It has this little chart that talks a little bit more about Medicare coverage options. You don't have to go into detail at all. I never do. But right here on Action Now, call Harlan, write down his number. Action Now, consider your health care plan. Are you satisfied with it? Is it fitting your needs? Action Later, in the retirement package, we'll make a decision. For all your Action Laters, we'll be doing the Action Later with the retirement package. Now, continue down the page. We're looking at capturing military service. I'm not covering that. I will physically cover that, X that out. I'll say, now do you have any military buyback? And they'll say no. And I'll say, okay, I'm going to put an X on this so that when I leave it with you, you're not confused. And you're not an old timer. You're not a civil service employee, which we'll cover civil service in another video. And so I'll X it out so they don't get confused. And that brings us to page 9, which talks about Federal Employee Retirement System. That's their FERS annuity, that Retire 8. You want to be really familiar with page 9, every paragraph in there. I'm not going to walk you through that because that's really just information that talks about retirement supplements, etc., etc. So let's look at page 10. I'm going to find that on here. Here we go. We're looking at page 10 now together. Now their FERS annuity is what the federal government will pay them for as long as they live once they retire. And the formula is right there on the bottom, right here. And it says if they're under 1% if they're under the age of 62. Most people you're going to work with are going to be over that mark at retirement. So you don't want to get confused there. Let's say you're dealing with someone who is 60 years old and they want to retire in 4 years. Well, you would use 1.1% because in 4 years they'll be over the age of 62. That's part of that listening. That's part of paying attention to the focus of this presentation, which is at retirement. This big, beautiful chart right here is based on under age 62. This whole chart is 1%. Let's do some quick math, and we'll walk you through how we calculate their FERS annuity. Look, we'll use this chart. We're going to use a 1% example. So this person is going to retire under the age of 62. And we'll say that total years and months. So let's look at this formula. We're going to use 1%. Total years and months. This is full-time years that they will have at retirement. It does not include part-time, but it will include military buyback. So if they're going to retire with 20 years in, and they bought 3 years of military buyback, then their total years would be 23 years. It's important to know that with their sick leave and with their military buyback, you cannot make a year. It's added on to what your actual hard years put in were. So if they wanted to retire, they're like, well, I want to retire 20 years in. I've worked 17 years and I have 3 years military buyback. Well, the 60 and 20 is a magic number, and you'll know that once you read page 9. They can't make up those years by the military buyback. You got to put in the hard time. But for this example, we're going to do 1.1%, and at retirement, 1%. We're going to use 1% times total years. We'll use 20 as an example. Times, it says high 3. Their high 3 average is consecutive years of their highest base salary. It's usually the last 3 years they work. We're hinging hard on an estimate. You do not want to use, always round numbers, and I like to round down. The exact number will be in their retirement package. And so for this example, we'll use a high 3 average of 60,000. That number can change. Let's say you're dealing with someone who's going to work for another 5 years and their base salary is 58,000. You might want to do a high 3 average of 60,000 because they're going to work 5 more years. If they're closer to retirement, maybe use their current salary. Hinging there heavily on a good estimate. So we do 1% times total years, we're going to use 20, times high 3, and we'll use 60,000. And you should get 12,000. Now that number right there includes an entire, that's an annual number. So we need to divide it by 12, and you should get 1,000. If you come up to this chart, if you go to 60,000 all the way across to 20 years, you see that? It says 1,000. Now, there's a 900 right underneath that number. Here's the difference between these top and bottom numbers. The top number is a single life number. If you elect a single life premium, then as an individual, you will receive $1,000 a month from the federal government as long as you live. And once you die, check stop. Or you can take a spousal option. And they'll reduce your number by 10%, so that's your 900, and you'll receive, or he'll receive $900 for as long as he lives. And if he dies and his spouse is still alive, then the spouse will receive half of that 900 for as long as the spouse lives. You'll want to decide that when you're filling out your retirement package, because you only get one shot at picking. Are you going to go single life or spousal? Sometimes, let's say that you're dealing with a postal or a federal employee that is considerably younger and healthier than their spouse. Then they might go single life option knowing they're going to outlive their spouse. That's just something that you want to look at. With the FERS annuity, the big thing you want to do is just simply talk to them and figure out when they're going to retire. Let's use those same numbers at 1.1%. So let's say the person we're working with is going to retire when they're 65 and they'll have 20 years in. So we'll do 1.1% times, they'll have 20 years in, so we'll put 20. And let's say their high 3 average, let's go with 60 again, is 60,000. You should get 13,200. Again, that's the annual number, so divide it by 12 and you'll get 1,100. So you'll see that's a bigger number than on the chart above, because the chart above is for people that are under 62, so it's figured on 1%. Because the math is so simple and so quick, just do it every time. Don't even really look at that chart. But when we're talking the FERS annuity, what we're doing is walking them through and explaining them what it is. We'll calculate it. We'll explain the spousal option. We're going to remind them that this is a big part of their retirement, and we're going to move on. So the next thing and the last thing we'll talk about in this section is the Social Security, which is another part of their retirement income. Social Security is a big deal. It's a big buzzword. Everybody's really excited to talk about it. You said in your Power Start that you are going to put together a Social Security report that's going to detail the options they have with their Social Security income. Therefore, we want to just keep this very surface level on what we're going to talk about in Social Security, because we will have another video explaining how we go through and complete a Social Security report. So for the sake of your actual presentation in the field, when you get to Social Security, just simply ask them, how old are you? When were you born? So you're full, and look at the chart. Let's say they were born in 55, so their full retirement age is 66 and 2 months. And by the way, I'm looking on page 13 in the PBA right now. You ask them their age. You let them know real quickly their options of Social Security, which is you can take it early, you can wait till your full retirement age, or you can wait till you're 70 to draw. The report's going to show out more of that. You'll ask them, what is your estimated income? Have you been to SSA.gov? And just ask them, what's your number, so to speak. Social Security, on the Action Now, Action Later. Action Now, go to SSA.gov. Action Later, tell me what your exact number is if they don't know what it is. FERS annuity, I'm going to jump back to that real quick. On the FERS annuity page, when we're talking Action Now, Action Later, which is on page 11. On their FERS annuity, Action Now, just think about spousal or single life option for retirement. Action Later, when we're helping you with the retirement package, we'll decide which option to go to. They don't have any say in what they're going to pay into FERS or Social Security. They just get to get the check what the government says they're going to get. Rather simple. Hopefully you have this PBA printed out and next to you, next to your bed, on your coffee table, in the bathroom, and you're very, very familiar with all of the paragraphs in the river. You won't necessarily talk about them every time, all of the information but it'll help you be confident, and it'll help you understand where you're going and what's going on within the presentation. I'm going to run through. I'm going to start on page 3, and I'm going to go through Medicare all the way through Social Security. Similar to the pay stub, it is short and sweet, but if you can stay on track and flow the way that I'm going to go through it, then you'll be doing just fine. And we'll be using the base salary of $60,515 like we did on the group life insurance. All right. Now, do you have any questions about the Action Now and Action Laters for your pay stub or your group life insurance? No? Okay. Well, looking on your pay stub, you have this HP 105, and you had said that's Blue Cross Blue Shield. The next thing we're going to talk about is your health insurance and how you're currently covered. Right now, you're paying X amount for your health insurance with Blue Cross and Blue Shield. And you may not realize this, but you're actually receiving a government subsidy on that health insurance premium. So it's reduced now, and when you go to retire, that subsidy is going to go away, and your cost will increase. The exact number of that cost will be revealed in your retirement package, and so as you get closer to retirement and you order that package, when we go through it, we'll actually see that actual number. But right now, you're 3 years from retiring. Keeping your current plan and just doing what you're doing is your best route. Now, at retirement in a couple years, you're going to have a couple options. The first option you're going to have is to keep your current health insurance, knowing that the subsidy is going to go away, but in the premium will be increased. It's not like a massive increase typically, but it's definitely a higher number. The second option you have is when you become Medicare eligible, just going on Medicare. You get option A for free. You look on your pay stub. You've been paying into it as you've been working. But to make it a full plan, you got to look at Medicare Part B, C, and D. The good thing is that these parts, they're the same across the insurance companies. You just got to find the best rate. And the third option you have is to just buy a new healthcare plan altogether, the one that might be custom tailored and fits your needs a little bit better than maybe Medicare or your current plan would. A lot of this stuff, as it relates to health insurance, is subject to change drastically, possibly in these next 3 years. But we have a guy, his name's Harlan Pickett. He is on our advisory board. That is a specialist with health insurance. And I'm going to write down his number right here on the action now. And I want you to call him. He's not going to sell you any health insurance or anything like that. He's just there to advise. And talk to him about your current plan, especially as you get closer to retirement. And he'll advise you and point you in the right direction of what could be your best health care route. So I'm going to write his name down here and action later. Don't forget to call him. There is no action later. Action now. Call him right now. Now, do you have any military service? Nope. Okay, I'm going to put a big old X right here. You are not a civil service employee. So I'm going to cross this page out because it does look kind of similar to the next section, which is the FERS. You're a retiree. Let's go to your pay stub, that retiree that you've been paying into it. Tells me that you're a FERS employee. Now, what the FERS annuity means is that you're going to get a monthly check from the government as long as you live. And if they don't calculate it on how much you paid in, they actually calculate it on how old are you when you retire, how many hard years you put in when you retired, and what's your high 3 consecutive base salary average. And then they do this little formula, and that's your number. It's an important part because it is the first part of your retirement income. Now, you don't get any say. They don't tell you how much you're putting into it, but at least you do get something. So at retirement, you're going to be 65 years old. And you have how many years in right now? 17. You said we're trying to retire in 3 years. So that'll give you 20 full-time years, correct? It won't include part-time. Okay, yeah, good. 20 full-time years when we retire. And right now your base salary is at $60,515. Over the next 2-3 years, you'll probably get a raise. Let's just put $61,000. It might be a little low. You could get a big raise, but also in the retirement package, your number will be there. And so, what you can expect, and again, this is an estimate. What you can expect is about $1,100 a month from the federal government. $1,100 and some change. Now remember, all this money isn't been taxed yet, so they're going to give it to you, and it's going to be treated like income, so it will be taxed. But that number is a single life number, and what that means is that as long as you live, you're going to receive around $1,100 from the federal government each month. And when you die, the checks stop. You can take a spousal option where they're going to reduce that number by 10%, and they're going to give you that reduced number for as long as you live. And when you die, if your spouse is survived, then your spouse will receive half of that check that you were getting. I'm going to take a note here on the action now because we're going to work 3 more years. There's nothing to do because you have no say in it. Just keep on working hard and be safe. Action later, when we're doing this retirement package, we're going to want to decide, are we going to go single life route or spousal route? We don't have to decide that now, but that is something we will have to decide because you only get one shot at it. You can't retire and then decide, nope, I want to change it. So we'll think about it then as we get closer to retirement. The next thing we need to talk about is Social Security. This is a big deal. This is the second part of your retirement income. You have your FERS annuity and your Social Security. And this is completely government controlled. You don't really have any say on it, but there are a couple options that you have. You can either draw it out early, you can wait till your full retirement age, or you can wait till you're 70. If you go early, the check's going to be smaller. If you wait till your full retirement age, that's going to be a little bit larger than 70 is your biggest check. We are going to put together a Social Security report that's going to be very detailed in all the different options you have to maximize your Social Security income. And so right now, for me to get that report together, I'm going to have to tell you to go to ssa.gov. Type in your Social Security number, go through some questions, and you're going to get an actual number of what your Social Security income would be based on when you're going to draw it out. Have you looked at it recently? Have you got anything in the mail? You're at about $1,800? Okay. Still go to ssa.gov, confirm that, because action later, we're going to need some of that information from that website to complete that Social Security report. Do you have any questions on that? No? Excellent. Guys, the river is that short and sweet. There's not much detail we want to go into. What we want to do is just let them know where they're at and what it's going to look like at retirement. Obviously you need to overemphasize that these two parts are very, very important because they make up two of the three parts of their retirement income. Study hard, keep at it, and have fun. Thank you.